Bismillah ar-Rahman ar-Rahim. Usefulness of cordotomy in patient with cancer who experience bilateral pain. Implications of increased pain and new pain. The category of the study is therapeutic. Study BICO. The population is those people experiencing bilateral cancer pain. Intervention is not applicable. Comparison of unilateral versus bilateral cordotomy. The outcome relief of pain, increased pain, and new pain. The study setting, it is a multi-center local study. The principal institution is Aiyam University Graduate School of Medicine in Japan, Department of Palliative Care Medicine. Study subject, the total number of patients who underwent cordotomy is 26. Male to female ratio 15 to 12. Inclusion, exclusion. Patient experienced bilateral cancer pain who underwent percutaneous cordotomy through C1, C2 vertebral space from 1986 to 2009 were enrolled in this study. Cordotomy was indicated for patients with refractory severe cancer pain, but not for patients in poor general condition with a life expectancy less than 1 month or with symptoms of respiratory dysfunction. Prevalence rate of cancer pain 33% after curative treatment and 64% in patient having advanced disease. Study objective is to assess the usefulness of cordotomy for bilateral pain from the viewpoint of increased pain or new pain caused by a referred pain mechanism. Study was observational, retrospective. The study groupings, the first group, those patients with and without increased pain after unilateral cordotomy. The second group are patients with and without new pain after bilateral cordotomy. The study length was 23 years from 1986 to 2009. The median period of follow-up after unilateral cordotomy was 56 days. The median period of follow-up after bilateral cordotomy was 42 days. Data were collected respectively from medical records. Study findings. Total number of patients who experience increased pain after unilateral cordotomy was 19, while 7 patients did not experience any increased pain. The total number of patients who experienced new pain after bilateral cordotomy was 7 patients, while only 6 patients did not experience any new pain. Study finding, increased pain occur in most patients experiencing bilateral pain after unilateral cordotomy. New pain occur in most patients in whom original pain on both sides was relieved by bilateral cordotomy. Severe increased pain after unilateral cordotomy can be relieved by bilateral cordotomy. New pain after bilateral cordotomy is weaker and better controlled than the original pain in most patients. Other conclusion, bilateral cordotomy can be indicated for patients with uncontrolled bilateral pain because severe increased pain after unilateral cordotomy can be relieved by bilateral cordotomy, and new pain after bilateral cordotomy is weaker and better controlled than the original pain. Future steps: the author said a prospective study including a larger number of patients is necessary for confirming the findings. Sign quality criteria. The principal investigator is Dr. Higaki, who is an assistant professor in the Department of Anesthesia and Preoperative Medicine at Yale University School of Medicine, which is adequate for the current study. The study's question is original, since no study have yet addressed the speculative mechanisms causing new pain in patients who experience bilateral cancer pain after bilateral cordotomy. The study conclusion is relevant to the anesthesia practice and other practice. The discussion section is adequate and relevant. The study writing is clear and organized according to the international standards. The key operational definitions and also the main procedure are clearly explained by the author, which are cordotomy, new pain, and increased pain. Since this study was done retrospectively only on 26 individuals, therefore we believe it may not be entirely applicable to the current clinical situation. Also, the degree of patient satisfaction and the influence of cordotomy on patients' quality of life were not investigated in this study. Sign headline: despite the drug therapy and nerve block for patients who have bilateral cancer pain, the bilateral cordotomy remains a beneficial next procedure for refractory severe pain in the lower half of body in particular. Regarding JCS level, we give this study a level B, which is moderate quality evidence. Therefore, clinicians should not consider this study conclusion on a routine basis unless there is individual consideration. Thank you.